Joining us in the studio this morning, Dr. Jonathan Tripp. And the doctor doing something unique this week. You know, there's a line that Rush Limbaugh uses on his program. He says that throughout the week, he picks the topic, but one day a week, he lets the audience pick the topic. Well, Dr. Tripp is doing something very similar to that today. Uh, he's actually normally we come in here and you sit down with me and we have a conversation about a specific medical issue each week.
Yeah, trying to cover a topic that
And
we're doing.
your thinking is this week. Your thinking is this week is that what we'll do is we're going to open up and find out what actually is bothering people who are listening this
Yeah,
morning.
whatever questions you have, um,
Ask the specialist. I mean,
there you
you
go.
know much more about medicine than I do.
Well, and I can give up some ideas because I have some resources and looked up kind of the top 20 conditions of family practitioners, so I can throw out those things. But really, this is supposed to be a morning of you bring it on, and we'll at least try to discuss it. And if we don't know, we'll try to get a resource to figure out how to find an answer.
I got to tell you, your advice a few weeks ago, I took some of it.
For what? For once, right? No,
Yes,
no.
I was years ago. I had terrible rashes on my hands, and I turned out I moved to a new house, and they went away, which meant it obviously was environmental. But I took your advice on the olive oil on my hands, and I had chapped hands to the point they were breaking, and my gosh, they're much softer and healing just fine. And that's all you're doing. We have a couple of people looking to chat with you already this morning.
Well, let's have some fun.
And it's Better Health with Tripp Family Medicine. Remember, life's too short not to feel good. 8:35, you're on the air with Dr. Tripp.
Good morning. Several weeks ago, you said you didn't understand why there were insect bites in the winter. People who have fireplaces and wood stoves bring in firewood from the cold, and when the wood warms up, dormant spiders and the insects wake up. For advice, there are old remedies like chicken soup or tea with honey and lemon for colds. I would like to know if Gatorade and Powerade with electrolytes help out.
If they help out, the answer is yes to a large degree. Um, Gatorade and Powerade are sold mainly as kind of a sport recovery drink, although we drink them for all other reasons, just because we like them. But the electrolytes are an important part of trying to keep out of muscle cramping under especially extreme exercise. And so, the famous Gatorade that started with, I think it's University of Florida, or at least the Florida Gators, um, was basically a formula made up by somebody there at the university to avoid the football players going into major muscle cramps when they're playing all full pads and in the heat.
And
Uh,
a Southern football program, too, especially in, I guess, September and the like. It was hot during a game.
oh, very hot. You have 80, 90, 100-degree weather with nearly 100% humidity. And like when we sweat here, it helps cool the body. They sweat there, they're just wet. It isn't cooling them much. So there is definitely benefit to the electrolytes in that. I'll give you a couple other ones. People talk about drinking pickle juice, and that's the same theory, is you're getting a lot of salts, which are what our electrolytes are. But I would also caution that, if you're doing a lot of salts, and especially if you have high blood pressure or a tendency towards swelling, you're going to cause yourself trouble. So there's a caution there. But the biggest deal I can tell you for almost anybody is hydrate, hydrate, and hydrate. But the answer is yes to that question.
Now, when I was in high school, even in the northern climes, it would be still hot in August, and we had a running back who he would sweat profusely in practice, and we'd be doing the 2-a-day workouts, and the coaches would give him salt tablets to drink with his water on the sideline.
Yeah, and the salt is actually to help retain fluid. And so I can give you my personal history. If I go out to eat, especially chips and salsa at a Mexican restaurant, I won't eat 3 pounds of food, but my weight will be up 3 pounds the next day. And then about 2 days later, it's right back down. And that's all about the salt. So water follows sodium. So in particular, that pickle juice or salt tablets, you will retain water. I used to do that as young men, plastering pools as we were out in the heat during the middle of the summer and lots of sun beating down. The salt tablets are what would allow you to maintain your water to not get terribly dehydrated and lightheaded during the day.
Now, we want to point out the doctor, of course, we got a short break coming up, but he's available to take your. Want to thank the caller as well. The doctor is available over the next 20 minutes And as we say, today is
This is fun day.
open line. Right.
Open line
Yeah.
day. Yeah.
Yeah. We're just, so anything that you'd like to know about on a medical issue, or you've got something going on. That a friend of mine sent me a message last night, and he's a preacher. He was going to do a presentation when he had a pain on one of his arms, and he lifted up his arm, and on the inner arm near the bicep there was a tick trying to burrow in. And
He must have had some of that firewood in his house.
yeah, he
Okay.
very well could have, but he ended up removing it on his own. But he said he couldn't understand what the sharp pain was. So there you go. There's one of those unusual topics people deal with. We've got more with the doctor on the way in just a few minutes. Dr. Jonathan Tripp in studio with us until 9 o'clock this morning. And it's 39 already at News Radio 1310 KLIX and newsradio1310.com. Joining us in the studio, Dr. Jonathan Tripp from Tripp Family Medicine here in Twin Falls, Idaho, and that's located on Fillmore Street, directly across from the main post office in Twin Falls. That's on the north side of the city. And Doctor, what's the contact information?
If you're trying to reach us by phone, our phone number is area code 208-933-4400. So that's 933-4400. Website is trippvalleymedicine.com, and Facebook. You can reach us at Tripp Valley Medicine, and love to have you love or like us, whichever way you want to do that. But we have some fun posts that come just random times for random reasons. But sometimes it's somebody who's a new patient, and other times it's one that's been around for 4 or 5 years and then turns around and says, "Oh, by the way, I just want to tell you my longer term experience." So that's been some fun stuff we've had lately.
Want to point out, life's too short not to feel good is the slogan at the doctor's office. And he's hoping to help you feel good today. He's answering questions you may have on any medical issue that you've got, or you know someone perhaps who has a medical issue. Telephone number is 736-0300. We pretty much finished the bug bite portion of the program, 736-0300. Although, if someone still has a question or comment on that, that's fine too this morning. It's a bit of like an impersonation of Rush's Open Line Friday
You
today.
bet. I'll throw out some ideas. We have, shall we say, a top 20 diagnoses that I can list off, but also a lot of people have questions about what is called complementary medicine or alternative medicine.
That's not "you look fine today."
That's right, complementary medicine. You want to feel good? I'll tell you. So anyway, having fun with this. What you'll find in our office is truly evidence-based medicine being practiced by all of our practitioners, but at least with an open ear to alternative or complementary medicine. My own personal philosophy is, not all things natural are safe, but if it's safe and you want to give it a try, let's do it. So I have learned from patients certain things that I now pass on to other patients, some through research, some through study, and I'm very open to hearing those things, but at the same time try to keep the evidence-based training that I have as part of what we really go after most of the time. But especially if somebody comes in and says, "Hey, I don't want to do it that way. I want to do this first, and then if that doesn't work, then I'll talk to you about traditional medicine." I am almost always very easy to go down that road, unless there's some immediate threat or immediate danger. I'm always willing to take time and say, "Hey, let's try that."
We've got a caller with us, and caller, you're on the air at 8:45 with Dr. Jonathan Tripp. Go ahead.
Good morning.
Good morning.
I got a question. I'm a 48-year-old truck driver, and I'm about 20 pounds overweight. And I hear these advertisements about this Andro 400 or Andro 4000 fat burner stuff.
Okay.
Could you throw a little insight on that? Do they work? What are they? Should you just go buy them at your local vitamin store and give it a shot? Could you add a little insight on that?
I will do my best. I'm going to give you kind of a generalization, and then I'll see if I can find little details on what's the ingredients in the Andro 400. But in general, fat burners for weight loss are usually stimulants. So things like, excuse me, things like caffeine. There's a South American herbal called guarana, if I say that with an American accent. There's cola nut. Quite a few other things that they'll throw in. We used to have ephedra, and that got outlawed by the FDA. But these are all stimulants to force your heart to work harder, can keep you awake at night, or even give you heart palpitations. And for the most part, it's like having high doses of caffeine or the energy drinks in a pill, and they will make your body work harder. So as a result, you tend to have a lower appetite, which caffeine and other stimulants are appetite suppressants. Um, but the downside is if your body is struggling already, especially if there's a heart condition or blood pressure problems, you're going to push that blood pressure up. You're going to push your heart rate up, and that's not all wonderful. It's actually kind of a threat. So if you've got a struggle or a worry about your health, for starters, I'd say at least come in and let us take a look at you, do a little bit of blood work, make sure that, and maybe an EKG to make sure heart seems to be working well before we start on something that might push it. And let me see if I can give you specific about the Andro 400. It's they're not giving me the ingredients. That's a dubious moment.
Not a good sign.
Or at least not an easy. The ingredients are not at the top of their list, I'll tell you that. Um, Come on, there's your formula. See, it makes these claims like it facilitates efficient blood circulation throughout the entire body. I don't know how they make that claim, but the biggest claim for this Andro 400 is that they're saying it safely increases testosterone. So they may have some pre-hormone type medicine in it, like DHEA is one that you can buy over the counter separately, that your body may increase its testosterone production, or it may increase its estradiol production. So if you're a guy and all of a sudden you start finding your chest is getting bigger, and it's not because your muscles are bigger, that's your body is converting that to estradiol. So um, this is one that, without having the ingredients right in front of me, and I am trying to find it right now. Um, I can't tell you too much about it, but they have lots of claims that I bet they don't have much of a study really to prove any of them. It says more energy and stamina, reduced body fat, increased libido, increases muscle mass, muscle tone, more strength and endurance, reduced aches and pains, greater sense of well-being, controlled blood glucose levels. These are all things that increased testosterone truly does have. Lowers LDL cholesterol. That's not always true if it's testosterone. But in any case, my guess is if I had the actual ingredients, there's probably not a serious study to prove that this is true, because it's a supplement and it does not have to be cleared by the FDA, so they can make any claim they want.
We have another caller with us. Caller, you're up next, 10 minutes away from 9 o'clock, and you're on the air with Dr. Jonathan Tripp. All right, we're going to try line 3. Caller, you're up next. You're on the air. Go ahead.
Thank you. I'm one of your patients, and I went up last night and went to this seminar. It's called Amniotic Stem Cell Therapy,
Okay.
and I was just wondering, have you heard of that, and what do you think of it if you have?
I'll be happy to address that. Stem cell therapy as a theory is an awesome or a potentially very powerful treatment plan. There are some doctors that are using this for muscle and tendon regeneration. I have a patient who actually went to a clinic in Utah that does this for rotator cuff or shoulder pain, and they do injections under anesthesia. And it's these injections, I'm not sure if it's the amniotic stem cells, but stem cell is the general theory. And the few people I've seen have seen great results. The problem is I don't think it has a wide base of study behind it, but at least the theory behind it is very exciting. And so I can't say that I wholeheartedly endorse it. On the other hand, I have some excitement about it. So that's about as detailed as I can give you.
A couple of years ago, before he passed away, Gordie Howe, the legendary hockey player, had been suffering from Alzheimer's, and there was a stem cell treatment that he got, and he had been essentially just catatonic, sitting in a wheelchair, occasionally moving around by pushing his feet on the floor. Within a couple of months of the surgery, he was playing soccer with his grandchildren again in the driveway.
Wow.
Now he did pass away from old age, about a year after that. But it shows you that there is some possibilities with some of these surgeries or
Yeah,
some of these treatments.
I think the struggle is there hasn't been enough done. They're considered experimental, so insurances don't cover them. So it's the kind of thing, if you are paying out of pocket, it's a kind of a hit or miss. It may work, it may not do anything. The worry is what harm could it do? And there is a potential for harm as well. And sometimes, in the case of the shoulder I was talking about, the harm could have been loss of function of that shoulder. And the person getting that procedure might say, "Well, I'm not using my shoulder very well anyway, but let's give it a try." And for them, so far it's worked, and they're about 3 months out, and feeling a lot stronger and moving a lot better. So the little experience I have is good experience. It's just still an unknown, and it's still experimental. I love the idea.
You referenced the testosterone promises from some of these televised medicines
Yeah, over the counter.
over
Yeah.
the counter. I was driving down the road the other day. I was out on just a road trip. Went to do some photography, and I was coming back listening to a radio show. And a fellow was saying there's some new medical research out that shows if you're the top dog in your office, that you're going to have higher testosterone than a guy who's on the bottom rung. And it seems that if a guy gets a promotion, his testosterone level goes up. Ever hear about that?
I don't know that, but if I took my own office, you'd have to say that our office manager, my wife, has the highest testosterone. So I don't know that that's accurate, but it sounds great. In fact, the truth is if testosterone is really the worry, um, then let's be seen by the doctor. We do testosterone replacement all the time. I'll give you the caveat. In about the last 2 years, the FDA has come out and said where they previously did not think that testosterone replacement was causing any trouble with heart attacks and strokes, they're now seeing information through other studies that in some cases at least they're seeing increased risk for heart attack and stroke if you're over 50. So if you're 35 and your testosterone's low, see a doctor. If you're 50, there's going to be a longer discussion, and some doctors won't prescribe it because there's concerns, there's worries, there isn't yet a hard line about that. But at the moment, you have to weigh the pros and cons. But all of those great things that we were looking at on the that Andro 400, all those great promises about feeling better, doing better, better muscle energy, uh, all that, they are to some degree true. And some people respond just dramatically well to testosterone. But a lot of people do that with just straight up exercise. So we could talk about that too.
We've got another caller with us. Caller, you're on the air on Top Story as well as Better Health with Tripp Family Medicine. Go ahead.
Thank you. I was wondering if Dr. Tripp could maybe explain and educate us about Hashimoto's disease and what kind of hope there might be for somebody who has it. Thanks.
You betcha. Hashimoto's thyroiditis is the official name for that. And it is a condition that essentially, let me see if I can give you, I have resources that I'd like people to look at. When you want to go to the internet, um, there is one that is called myfamilydoctor.org, which is made by or produced by the Academy of Family Medicine. So that's a very credible source. Another one that I use a lot is Mayo Clinic. There's Cleveland Clinic, Mayo Clinic, Harvard. All of those have nice websites that kind of give overviews of different diseases. So if we look at Mayo Clinic's version talking about Hashimoto's, they say Hashimoto's disease is a condition in which your immune system attacks your thyroid. So this is an autoimmune disease, not to the degree where people feel like they have general problems like somebody that has lupus. Lupus has all kinds of weird presentations and trouble that way. Uh, Hashimoto's is it basically attacks your thyroid, which is just above your collarbone, runs around your trachea, and the thyroid often enlarges, or people will get what's called a goiter, because it's now under inflammation. And usually the test to do that is just some thyroid function tests. We do these every day in our office for people that already have known low thyroid or high thyroid, or we're just screening for fatigue, things like that. Thyroid is the hormone or the gland that produces really the hormone that regulates your metabolism. So, um, so the question you asked is, what's the hope? Well, the truth is Hashimoto's can be easily treated. It sometimes requires ablation of the thyroid. In other words, your thyroid's working too hard to get rid of. I can't get the website to go with me. Sorry. Um, it's working too hard to produce too little. In other words, it's the your immune system has attacked your thyroid, is kind of shutting it down. So your thyroid's response is, I got to work harder, and you get fluctuating amounts of thyroid in your bloodstream. So one of the treatments is either remove the thyroid with a surgery or to use radioactive iodine to ablate it, and then after that, almost always the person is on chronic thyroid replacement hormone, which is uh, relatively benign and easy to regulate.
And again, your office still looking for new patients. We've got to point out that if people would like to get in touch with you, how do they go about doing that?
The office, 933-4400. You can call us and reach some of the nicest voices on the other end of that line. Website, trippfamilymedicine.com, or on Facebook at Tripp Family Medicine. So probably the best way for you to contact us is really the phone number, 933-4400. And we are working towards having immunizations for the younger families. So pass that word along to your extended family. I think by the end of April, we'll be up and running with the state.
We'll talk again soon. 9 o'clock news straight ahead from Fox.